Hello and good afternoon, everyone. My name is Somesh Kumar, and I serve as the country director of JAPIGO in India. I would like to welcome you all to this informative and interactive session to discuss the importance of hand hygiene, hand washing and hygiene now and beyond COVID-19. As a brief introduction to myself, I am Somesh Kumar, and I've been working in the space of global health for a couple of decades across India and multiple countries across South Asia, Sub-Saharan Africa, and Southeast Asia. We are all living and striving through this era of COVID-19, and we have learned that personal hygiene is the primary defense to prevent diseases and is of utmost importance for our community's health. Even before COVID-19 pandemic, governments and health organizations all over the world promoted the need for having clean hands and appropriate hand washing behaviors, for they are precursors for disease prevention. Global Hand Washing Day, a global advocacy day, is dedicated to increasing awareness and understanding of the importance of hand washing with soap as an effective and affordable way to prevent diseases and thereby save lives.
No, I'm just talking to my
USAID's flagship health system strengthening project, NISHTHA, implemented by JAPIGO in collaboration with Unilever, is working across 4 states for promoting healthy hygiene behaviors. USAID-NISHTHA, in collaboration with Unilever, is rolling out a concerted communications campaign that includes celebration of key days such as Global Hand Washing Day. As a part of Global Hand Washing Day celebrations, NISHTHA is hosting a webinar aligned with global theme of Hand Washing Day. Our future is at hand. Let's move forward together. As I am provided with this opportunity for being the moderator today, I would like to introduce the respected panelists for today's lively session. I'd like to introduce and welcome Dr. Anuradha Jain, my colleague and longtime friend. Dr. Anuradha is the technical advisor in the Health System Strengthening Department at the USAID. Dr. Jain is a clinician with formal training in public health. She has been a public health practitioner for the last 15 years. For the last 7 years, she has been working with USAID providing strategic oversight to USAID's largest health system strengthening portfolio and leads USAID's efforts to integrate WASH and health across its wide portfolio. To discuss the behavioral nudges and evidence-based social and behavior change communication interventions for promoting healthy hygiene behaviors, we have with us Dr. Richard Wright, Global Sustainability Director, Unilever UK. Dr. Richard leads major cross-sectoral purpose-led partnerships. On Transform, he works with USAID and ENY to help digital SMEs develop business models that meet low-income household needs in Africa and South Asia. In 2020, he co-created the 100 million UK pounds Hygiene and Behavior Change Coalition that formed part of Unilever's and USAID's response to COVID-19. Further, we welcome Dr. T. Dilip Kumar, President, Indian Nursing Council. He has been a long-standing 43 years of experience in nursing. He was the advisor of Global Advisory Group on Nursing and Midwifery at WHO. Adding to his many achievements, Dr. Dilip is the first nursing professional from India to become a member of Global Advisory Committee of the World Health Organization. Investments in WASH are the need of the hour, and to discuss this, we welcome Dr. Amir Ullah Khan, Health Economist and Research Director at the Center for Development Policy and Practices. Dr. Khan has been a civil servant, then the Deputy Director and Senior Advisor at the Bill and Melinda Gates Foundation, Director at the India Foundation, and Executive Director at the Encyclopedia Britannica. He is also serving as the visiting professor at TIS. And finally, to throw some light on the role of industry associations and corporates in promoting hand washing, please join me to welcome Dr. Sanjeev Jha, Director, India's Sanitation Coalition, FICCI. Dr. Jha has made useful contributions as a research and consulting professional in sectors that mostly include sanitation, hygiene, and nutrition. He has served as the state head for Jharkhand for the Global Sanitation Fund program. I'm really truly thankful for our panelists to join today's conversation and the panel. Let's initiate this discussion with Dr. Anuradha Jain on the significance of the efforts and investments that are being made in the space of hand hygiene, especially in the post-pandemic world. Anuradha, over to you.
Thank you. Thank you, Somesh, for the introductions, and also to NISHTHA team for giving me this opportunity to discuss the topic. And while I was discussing that, I'm going to speak on a very important area. To my boss, she pointed out there is nothing called as post-pandemic Anuradha yet. Maybe we should call it either endemic, or we learn to live, in the situation. And I think she was quite, correct in what she was saying. So maybe we are still not in the post-pandemic world. We are going to coexist with the virus for a very long time to come. And the reason, Sumesh, I think it is important for us to agree, come in agreement to the terms that we have to live with this virus, is because hand washing has been an issue that has been neglected for quite long now. And even though it has been one of the cheapest way in which infections could have been infections could have been prevented in both the hospital settings, in home settings, everywhere across the world. And a small investment in the area of wash could have prevented so much of financing in the world that goes for curative care, all along. So I think if we sum up, we do our statistics, and I think a lot of people must have done that statistics by now, to say that how many antibiotics do we spend our monies on, how many critical care units do we build, and all this would be probably brought down to the level of half if only some of the measures of hygiene could have been effectively ingrained in us as children, as professionals, as adults, in all the stages of life. And just to put some statistics, because I think there are experts sitting on the panel who would speak about financing, would speak about the nudges, who would speak about the HRH part of the story, as well as how private sector could contribute. But just to put some larger picture and the perspective to this whole conversation, while we are talking, 3 out of 10 people are lacking access to sanitation in this country. There are children, neonates, who are dying because of infection that are caused by diarrheal diseases that can be prevented by simple steps like hand washing. And it is for nobody's fault, actually. We can't say that parents don't wash their hands because they don't want to wash their hands. Yes, SBCC is one of the area, people have to be taught why hands need to be washed. But it is also somewhere the supply side of the story which is lacking, which they don't have. And hence, how do we strengthen the supply side of the story along with the demand side is something that in the meso and the micro picture we have to look into in this post-pandemic, or so-called the coexisting world of the viruses. The healthcare staff and as I would say, while we are coexisting with the virus, we realize the importance of hand washing more in the hospital settings and in the clinical settings now, because we have seen the the devastation that COVID has caused both to the health workers and to the non-health workers. And we landed up in the stage of second phase of COVID because of certain reasons, because of certain hygienic practices we were not taking care of, without mask, without hand washing, after vaccine, removing our mask and going in open. So those are the practices that led to the second wave of COVID that we experienced, and because of the density of populations we have in this country. But to compound all this in the near future, the kind of climate change that we are going to observe, the kind of scarcity of water and resources that we are going to have, it makes it further more important for all of us to realize the best use of resources that we have. And when we give our SBCC messaging, we also need to, also focus on this climate change that is going to happen, and the kind of resource constraint that people are going to face, the financial burden of water and sanitation that's going to come on them with the climate change and the scarce resources, because the population is not decreasing, the density of population is not decreasing, but how will all these resources be distributed? And if these resources are to be distributed, would it be with an out-of-pocket expenditure that we are going to buy it, or is it going to be still a freebie for everybody? So with all those constraints, with all those issues in our mind, I think I will the only thing I would like to stress, and maybe in further question answers we can discuss it, that how private sector partners, how development partners like us, how colleagues and private sector partners like Unilever can contribute to some of these issues at the macro, micro, and meso level, and with the coexistence with some of these viruses and bacteria. How do we live in the world where we are today? So I would stop here and hand it over back to you, Sumesh, for further deliberation. Thank you.
Thank you, Anuradha. I so agree with you. Maybe just a quick follow-up, and if you can frame a response in 90 seconds or so on the equitability of interventions for and strategies for WASH, especially in the vulnerable communities and underserved communities. What are your thoughts on that? How can we increase the equitability of our strategies and interventions for these special communities?
No, that's a very important question you have raised, Sumesh. And we at USAID, we believe in the principles of equity, and we believe in the principles of, the whole principles of mapping the vulnerable population and reaching the services, making and ensuring that the services go to the most vulnerable in the communities, whether it be disabled, whether it be the women, the children, the tribal areas, or for that matter, neurodevelopmental disorder patients who can't care for themselves, who are very dependent on others, the people who are struggling with mental health. So these are the transgender, and COVID has actually shown that these people required the maximum help, and they didn't just need the SBCC messaging. They needed support for some of these what do you say, the access to some of the WASH support that we could have provisioned for them. And from USAID side, what we have done is, while doing work on home isolation, or for doing our work on critical care, or for that matter doing our work with the communities on TB, we have not just provisioned the SBCC messaging, but we have actually dwelled and we have gone into working on intersectoral convergence. We have moved into the whole arena of helping people get their social entitlement. So in fact, we have a program in one of the urban areas with a project that is helping the poor urban population to get their documentation that helps them get those social entitlements of wash. For example, for accessing a toilet, you need certain documentation to have, because of which government would give you that entitlement to have a toilet in your house. So that money would be transferred to your bank account only when you have those documentation. So we are not just, preaching people on how do they actually access sanitation, helping people get those facilities. So I think we work at the national level with the PMUs, creating PMUs and TSUs that formulate the policy and guidelines. We work at the meso level with the state level, but we also go down to as low as the micro level in the cities and in the villages to do this intersectoral convergence and entitlement insurance for the vulnerable population. And that's how we ensure that equity is maintained in the society. I hope that answers the question.
Yeah, thanks, Anuradha. I think the key word there was, for me personally, was the cross-sectoral interventions and going through the whole value chain from the top to bottom. So thanks for your insights. Now going to Dr. Richard Wright, Global Sustainability Director, Unilever UK. Richard, if you can share some of your insights on the most important evidence-based interventions and what you have learned through your incredible journey and your work in this space with this audience. Over to you, Richard. Richard, probably you're on mute.
That's a poor start. Thank you very much. Delighted to be talking. And I'm just going to try and cover some of our work at Unilever and what we believe in pushing hand washing forward. I think you can look at two things. You can look at increasing the motivation to hand wash and also increasing the ability. And we've talked about access as well. And I think in terms of, I'm extremely proud to be part of Lifebuoy's journey on mass communication, both on schools program, but also TV and radio advertising. And this is designed according to behavior change principles. So I'm not a big fan of the word nudges, but we understand what the drivers of behavior are in creating engaging content that motivate children to want to wash their hands. We can, I think the nice thing in Unilever, we can deliver this at scale and we can deliver this in partnerships and create the evidence base. And I've been part of creating the evidence base. The other bit, which is of my program, we can go to the next slide, is I worked with on large partnerships. And I think the bit that you can also look at is how you can create the world in which people wash their hands more. And so I think one of the really exciting things in working for a business is that we can do innovation. And we have done lots of innovation around the soap bar itself. But also I work with social businesses. And you can look at how the adoption and supply and create demand for marketplace innovation can also allow these behaviors. So let me give you an example, which isn't a hand washing example, but probably the easiest one to start with. Pay-as-you-go solar lights have been really successful in actually changing people's lives. So I've seen personally through my program is that actually if somebody has access to a solar light for the first time, particularly women can work longer into the night. They spend a lot of time typically looking after children and their families during the day, and actually entrepreneurial activity needs to occur in the evening. If they can't see, then there's a limited amount they can do. It allows children to do homework. It allows shops to stay open later. There are many advantages. So that's where an innovation actually changes behavior. So it's okay to communicate that children need to do their homework, but if they don't have a light, they can't do anything. So a lot of the things I've looked at is how we help social businesses develop and how we help them develop in a way that also creates the ability for people, not just the purchase, but how do we create the environment in which people, so it's, people will talk about nudges, but actually I think about how we shape people's world to make hand washing more likely. So let me give you a hand washing example, which is on the next slide, which is not perhaps quite obvious. So this is a business called Clean Team. Clean Team are based in Ghana, in Kumasi in Ghana. And what they do is they lease toilets to people, and people will pay a fee to have these toilets in their household. And then that will include the service collection of them and the emptying of them twice a week. So this provides people with access to toilets for the first time in their own homes rather than going to public toilets. It makes life safer for women. It improves the time in which children actually start to use the toilet, so they use the toilet earlier, and it improves the general hygiene of people, so they're not exposed to pathogens. What's really interesting about this is that once you have a toilet, you own a toilet for the first time, you start keeping your soap bar by the toilet. So you don't put in a public toilet because it goes missing. But if you have your own toilet, you keep soap bars. And we've shown through some of our research that if you have a soap bar by your toilet, you're 75% more likely to wash your hands after defecation. So what we can do is provide total wash. We provide something that allows people to go to the toilet, but also this promotes hand washing behavior and hand washing consumption. So what we're doing is we're creating not just access to soap bars, but the ability to use them, the ease of using them. You may call this a nudge, but I think this is also about designing people's world to make the behaviors more accessible. So I'd like to leave you with that thought, is actually think about how we create the world, how we design the post-COVID world around hand washing stations, around sanitation, things that make hand washing more likely, of course, also providing affordable soap. Thank you very much. I think I can pass back to the facilitator.
Thank you. Fascinating, Richard. Very nice to hear and very exciting to hear some of these interventions and innovations here. So maybe a quick follow-up, Richard. I think we have seen, you know, a large uptake and in the adherence to key practices, you know, for hand hygiene and overall sanitation practices during the pandemic. And as Anuradha said, during the pandemic, we are in it. I will not say post-pandemic. Hopefully we are, though. I at least hope. That said, how do you think, you know, what are the challenges in sustaining these behaviors post, again, without saying the word post, but whatever we took it up, you know, whatever our communities, societies, ourselves, we took it up. How do we sustain those? What are the challenges there that you foresee there, and the strategies there thereby?
So you've hit one of my passion points now. We've seen through other crises that actually behaviors were adopted during the crisis can fall back. So a model we have is actually the drought in Australia, where there was a lot of water conservation during the drought. As soon as the drought conditions improved, then water went back to its original levels. So we are concerned about hand washing behavior falling back from the levels post-pandemic. My belief is that actually we need to strengthen behavior change capabilities of countries. And people think about, okay, capacity building at a government level, but actually you've got to think about it at different levels as well. So strengthening the capacities of also social businesses, large businesses, SMEs, and also NGOs to deliver really effective behavior change campaigns. Or not just campaigns, but obviously, as I've said, innovations. So I think it's extremely important to think about how the partners work together, how they deliver together, and how we raise their capacity to effective behavior change. Very often I've seen things out there as I travel the world, where it's like, if people think if you put knowledge in people's hands, then they will do the behavior. There's a lot more to it, which we know on this call. So I think capacity strengthening and thinking about how governments, private sector, and NGOs work together is huge. It's going to be hugely important in maintaining and washing behavior.
Thanks, Richard. So moving on to my longtime colleague, very respected, and from my side and in India and globally in the nursing profession, Dr. T. Dilip Kumar. So my question to Dr. T. Dilip Kumar is that, frontline health workers we have all seen how they have come out as the life-saving superheroes in this critical time. And so can you share, sir, on their contributions to this space of promoting healthy hand hygiene behaviors among communities through their really inspiring work through the times of COVID?
Well, greetings from the Indian Nursing Council. I would like to congratulate the USAID for organizing the hand washing day, which is a very important fundamental for the nursing profession in our day-to-day activities in the hospital and also in the community. As you know that especially our nursing professionals, the day one, in the inspection, prevention, control measures, in our fundamentals of nursing, the nurses are taught the hand washing. For various reasons, especially when the auxiliary nurse midwives working in the sub-center level in the rural area, where they may not be having the running water facilities. That is one of the challenges for the ANMs in the rural area. And also many of the health institutions in the rural area, they have also the facilities. But in the major district hospitals and in the tertiary institutions, this is very we have a very good infrastructure in the hospitals where they have all the facilities. So even then, many a times we miss the opportunity of doing the hand washing before starting the procedure. I think we have to the mindset of the people, which is repeatedly taught in the curriculum and also in the day-to-day activities, so they don't miss that opportunity of hand washing before starting the procedure. During this COVID-19, I think our nursing professionals, as you all know, that we are the warriors in this whole episode of this pandemic of COVID-19. They were demonstrated their role in taking care of the COVID-19 patients, especially in the ICUs, in the critical care units where they are taking care of the patients. I think successfully they have followed this hand washing, which has definitely has prevented the infection control measures. I would like to at least way back, at least besides this point, I would like to give an example how we trained our illiterate people to understand how important to wash the hands. Many of the healthcare professionals we have studied and we know the evidence and all those things we know. But when we are working with the community, we are the one of the auxiliary nurse midwives and the nursing professionals as a public health nurses working in the rural community. We have an important role of educating the community in the hand washing. That is one of the very important role we play. I myself had an opportunity of while working as a deputy nursing advisor in where I was looking after the training of guys in the traditional birth attendants, which is one of the program which I was in charge. At that time, we had a challenge of educating the illiterate, especially the pregnant mothers and the dye, especially where they have to cut the cord, where the hand washing is a very important technique. And they used to say that no, my hand is very clean, no need to wash the hand. How to make them to understand, make them to realize how their hand is not clean. So what we used to teach our ANMs is to work with the illiterate, especially pregnant mothers and the dais, ask them, give the one glass of water and ask them to dip their hand for some time, then show that water to them. This technique has helped the illiterate people. And when they used to say that my hand is very clean, and after showing that water, and they used to realize, yes, how their hand is not clean. And definitely this has helped the to sensitize, to create an awareness among the traditional birth attendants at that time. Now, of course, we are institutional deliveries, the percentage of deliveries, but still many a times in the rural area, in the odd hours, they might be taking the help of these DOIs. So therefore, I think the sensitization and using the proper technique for making the people to understand a very low-cost method of sensitizing. It doesn't cost much. Just you have to make them to dip their hand for some time and show that how their hand is not clean. And I am telling you, I have shared this experience with many of the occasions. Definitely this has worked. And in the rural area, it is making especially with the auxiliary nurse midwives and the public health nurses, they do use this technique to sensitize the illiterate people about how important to wash their hands. So this in this COVID-19, I think definitely there's more of a mass media that has gone in a big way of this media repeatedly pointing out to the even the non-health professionals. It is this mass media has definitely has put their non-health professionals how important the hand washing, and also repeatedly showing the video clippings in the it has also helped not only hand washing, how much, what technique they have to use this. Even sometimes whenever I am interacting with some of the non-health professionals, now they know the how much time they should wash the hand and what the technique. So this has made a big impact, this mass media, and this is going to pay dividend for the non-health professionals also in taking care of the in the different environments. Though this has made an impact. So therefore, I feel this repeated sensitization and a mass media, it is going to play a very important role in communicating the message of hand washing.
Thank you, sir. And we can always trust our nursing colleagues to inspire us and show some innovations always to inculcate these healthy practices. So moving on to Dr. Amirullah Khan, a health economist and head research director at the Center for Development Policy and Practices. So Dr. Amir, I would request you to share your insights on the significance of investments in WASH, especially the economic benefits, as you are an economist, bringing out that perspective for the viewers of this webinar. Over to you, Dr. Amir.
Thanks so much, Dr. Kumar. and thanks to everybody for this wonderful insights. I was really fascinated by what Dr. Anuradha Jain, Richard Wright, and Dr. Dilip Kumar had to say. And to that, I would just like to add my two bits, which is that it is the first point really that I want to make, and very clearly and loudly, is that hand washing in terms of any cost benefit analysis is the most significant intervention in public health. There is, we've done a lot of number crunching on this, looked at various interventions available, and it is very, very clear that along with vaccination of children, along with maternal health counseling, hand washing remains one of the best interventions in terms of purely in terms of cost benefit analysis, low cost, high benefit. That's the first point that I would like to make very clearly. There is enough literature that shows this, and this data has been analyzed from all parts of the world. In rich countries, there is data from the US and UK. In middle income countries, there is enough data from countries like Vietnam and Ghana, and in low income countries in sub-Saharan Africa and South Asia. We have shown this conclusion. The second point that I would like to make is that while this is so abundantly clear that hand washing with simple soap and water is the most efficient method of fighting the virus, the note of caution also is that in about half the world where running water is not available, this is not such a easily available luxury that we find existing in the rest of the world. And therefore, we need to have some methods, some innovations that will allow populations in these countries also to help themselves to this purely simple public health intervention. Now, the third point that I would like to make is, and then this comes from what happened during COVID, and this is an important behavioral communication issue that we need to highlight, and that is that during COVID a large number of patients got infected while in hospitals, and so much so that people started dreading going to the hospital for good reason. And the heightened awareness of opportunistic infections or hospital-acquired infections became a major scare everywhere. And even in that, and this is what I would like to identify and clarify and underline, is that even in that, the most effective strategy that we have seen to reduce incidence of hospital-acquired infections is simple hand hygiene. And this I emphasize because this is something that is a new scare that a lot of us are now hostage to, and therefore we need to know that even in hospitals where there is an atmosphere and an ecosystem that can breed and infect other patients, hand hygiene and hand washing remains the best possible measure against that. The fourth point that I would like to make is the fact that is the question that is there any alternative to hand washing? While washing hands with soap remains the simplest and the easiest intervention, is there any option for those people who do not have? Yes, there is, and we have seen that, and especially this year, everybody has realized the importance of sanitizers, of alcohol rubs and so on. And we find that, again, with a number of interventions that have been studied closely, we find that these alcohol rubs also have a tremendous impact in lowering viral infections. The fifth point, therefore, is that where it is not possible, or where we find that water sources are not available individually to individual households, where people do not have access to to the normal sink or the normal bucket that one is accustomed to, then the solutions that have come up are hand washing stations. Again, community-led or community-owned hand washing stations, and we found that this innovation was seen throughout Africa to counter Ebola, and it worked so wonderfully well. So having said these 5 simple points, the emphasis that I want to lay on is that we need to ensure that more and more people understand the importance of hand washing. And there, Dr. Dilip Kumar explained very clearly, Dr. Wright pointed this out, that this is a purely behavioral communication issue where we need to reinforce the importance of regular hand washing. And again, we have, there is a lot of evidence now where we see that communities that have a traditional habit of washing hands, either for religious reasons or for social reasons, tend to do better. There is absolutely no doubts there, and therefore that is something that we need to reinforce time and again. Second point is that we need to ensure that our budgetary outlays, which are limited where hygiene and sanitation are concerned, also have a very clear subhead which can be used to promote hand washing and to promote hand hygiene. This can be done very simply by ensuring that we encourage more and more community-led initiatives, local initiatives that would ensure that larger populations take to hand washing regularly, especially where countries like India are concerned, where we are talking about vulnerable mothers to be and vulnerable children. This becomes all the more important as we are going to the viral infections or diarrheal infections are going to result in huge losses due to morbidity and mortality. That is why it's an open and shut case. We need to invest in hand washing, and we need to invest in hand wash communication. Thank you very much.
Thank you, Dr. Amir. Very insightful and bringing out the economic case for investments in wash interventions and strategies. So moving along, like to go to Dr. Sajeev Jha, Director, India Sanitation Coalition, FICCI. And Anuradha already brought up the issue of, or rather the importance of partnerships with private sector for furthering this agenda. So in taking that, thread forward, can I ask you, Dr. Jha, to please take us through the important role that the industry can play in furthering this agenda, and your interventions and your work in this space so far. Over to you, Dr. Jha.
Thank you. Thank you so much. First of all, a great opportunity I'm deeply appreciative of, and such an interesting platform. A lot of knowledge has already flown. So I'll just try to overcome my nervousness a bit. And at the outset, I'm extremely grateful for the opportunity to be a part of this prestigious group, deliberating a theme of such topical interest. And thanks to the pandemic, that we are finally in a space where we are almost realizing that hygiene or hand hygiene is actually important and has the potential to prevent many common and life-threatening infections. Many illnesses start when hands become contaminated with disease-causing bacteria and viruses, and we all know that. Let me put some, numbers, some statistics that some of us are actually also involved estimating. However, other than the experts, none of us perhaps believe or realize them, but those are important, believe me. As per the NSS report, a 76 round 2018-19 data, nearly 36% of household members reported washing hands before eating, while 74% cleaned their hands with soap after defecation. When it comes to institutional hand washing facilities, including schools, nearly 820 million children worldwide do not have basic hand washing facilities at school, putting them at increased risk of COVID-19 and other transmittable diseases. And this is according to a report published by the WHO and UNICEF. The Indian scenario too is no less grim. To comprehensively understand the water, sanitation and hygiene status post the launch of the Swachh Vidyalaya mission, WaterAid India assists 453 schools in 34 districts across 9 states to take stock of wash services and infrastructure, understand the functionality and usage, and know the actual status. And the report revealed, interestingly, that compared to the availability of water and toilets in school, the presence of hand washing facilities lagged, as 31% of the schools assessed were deficient in hand washing facilities outside the toilet. 1/3 of the schools had no running water for hand washing, and a little over half did not have soap near toilet facilities. More recently, a sample survey of over 2,000 schools by the Comptroller and Auditor General of India, tabled in the Parliament in September 2020, revealed that over half of the government school toilets built by central public sector enterprises across 15 states, approximately around 3,000 schools, do not have been, do not have even the basic hand washing facilities, which is an even greater need during COVID-19, affected times. And the two major illnesses, other than COVID-19, all of us know, that are transmittable on the hands are diarrhea and pneumonia. Together, diarrhea and pneumonia cause more than 20% of deaths of children under the age of 5. And many of these deaths can actually be prevented by hand washing with soap. So notwithstanding the good initiative in this space, I would say, Somesh, that not much has been accomplished here until now, and that both the state and the non-state actors have of late also realized that.
So, Dr. Jha, how can we
come into that? Just allow me just a couple of more minutes, right? And I'm saying so because despite the fact that the foremost objective of the SBM Grameen 1.0, which is already complete in October 2019, clearly stated that the program would aim to achieve an improvement in the general quality of life in rural areas by promoting cleanliness, hygiene, and eliminating open defecation. But hygiene was the least cared for. A reason? Lack of knowledge? No. We almost knew as much about hygiene then as we do now, except perhaps the pandemic. What was missing perhaps was the creation of a descriptive norm around hygiene or hygiene behavior. So we employed the technique for eliminating, and the same technique we employed for eliminating open defecation, and we were successful to a large extent. Coming to your point now, I'm glad to share, and most of you are aware that key hygienic practices are being promoted under the IC component of the phase 2 of the Grameen mission. However, we are yet to see the change on the ground. Whereas many of us, including the development partners, would do their bit, besides the government, to achieve what is intended to be achieved in the hygiene space, IC at FICCI has accepted the challenge and would work to promote product innovation and business solutions, focusing primarily on hand hygiene, covering both the infrastructure and services, including the best practices, with support from partners like UNICEF and others. What we are going to do is to identifying innovative products and solutions and promoting and scaling up the most relevant ones through the industry platform is the agenda we have already started working with as of now. And we intend to achieve, through UNICEF support and other partnerships, and I'll try to articulate them now in just about 1 minute. identifying and rewarding innovative hand washing infrastructural products and solutions which are low cost, easy to maintain, sustainable models. Promoting and scaling up the price ones through industry platform of FICCI. Then identifying and promoting hand hygiene infrastructure management systems as well, both at the community and institutional levels, with focus on operation and maintenance, which is critical. And then piloting on the ground the priced hand washing infrastructure designs and documenting the performances and the best practices. And last but not the least, supporting online knowledge hosting and cross-learning platforms that work on knowledge management in WASH, including for hand hygiene. And I would like to, conclude by saying that these efforts, I'm sure, would be useful nationally and globally to bolster the hand washing agenda universally. Thank you very much, Somesh.
Thank you so much, Dr. Jha, for the remarks and sharing the initiatives of the industry. So towards the end of the session, so maybe I'll invite a couple of questions from the audience. You can either post it. So I see from Gaurav, Arya from SIF, the question, are there any innovative tools to demonstrate unclean hands? Who would want to take this question? Sorry, I'm not able to see everybody on screen. Richard, would you want to take that? Richard, are you there?
Yes, I'm here. Oh, sorry. So
there was a question on, are there any innovative tools to demonstrate unclean hands? So there was, if
I can hear you. Sorry,
you can't hear me. You cannot hear me. Okay. I
can hear you.
You can hear me.
I can hear you.
Okay. So anybody wants to take this answer this question on unclean hands? Dr. Dilip Kumar did talk about that innovative example. So there are, I am aware about an augmented reality tool that is available, when if you do have something after hand washing germs or some there, an augmented reality technology does help in bringing those out through some visual techniques, Gaurav, and we can do some digging there and talk about it. They are used in many hospitals placed next to the hand washing stations. So any other question? Any additional questions from anybody? And I cannot see. So maybe I'll ask a question and then we can. We were running 5 minutes. We started 5 minutes late, so I believe we have 5 minutes, if I'm right. So to Dr. Amir, a question to you on cost savings from hand washing. Why should governments and industry invest in wash strategies and intervention? And if you can share some financial strategies for doing that.
Yeah, thanks so much, Somesh. It is very obvious that hand washing results in reduction in the DALI, right? In the daily adjusted life year and in the quality of life. For corporates, there is enough evidence again that shows that where hand washing has been encouraged, there you find that there is a profound impact on absenteeism and on worker loss of attendance. Similarly, we see a impact on school children and on attendance rates. So there is evidence from every possible sector to show that a small investment in a soap and water or in an alcohol rub or a sanitizer results in disproportionate reduction in cost. From hospitals, the evidence is all over the place. There is a lot of evidence from hospitals that shows that patients recover faster, they do not get other infections. So therefore, it's really a very open and shut case. There is nothing much that needs to be done to prove, except to reiterate this, right? Except to say this again and again, that it is important for us to promote hand washing. I just had a little question to Richard, and that was that how expensive, which are the markets where you find a problem in selling soap? Are these markets that have very poor consumption levels, or are these markets that have that do not understand the importance of hand washing?
And Richard, you have maybe 75 seconds to answer that question.
That's a lot.
Can you hear me?
Yes, we can. Loud and
clear. I'm on live stream. I can't see myself on live stream, so I didn't know whether you could hear me. I think I think a lot of people do understand the importance of hand washing. I think and I'm not the best person to ask in Unilever for this question because I'm not a marketeer. But I think this, what I call soap poverty, is even just having one hand washing bar, because actually that doesn't give you all the opportunities. We talked about proximity being important. So I think actually many just have one hand washing bar, which not everybody has easy access to. So I don't think I can answer your question. I think the messages are generally out there. People understand the importance of hand washing when we ask them, but actually they don't have access or the ease ability to do it. So I think actually the importance of pushing and selling and making more available soap is the critical thing. I think that was less than 75 seconds.
Yeah.
Well,
you did very well.
Yeah, that's all I know.
Very well. Thank you. So so I would now want to hand it over to my longtime colleague and our longtime leader, Dr. Bulbul Sood, Senior Strategic Advisor for JPIGO, to provide us with a vote of thanks for today's session. It has been an incredibly enriching session, and JPIGO-NISHTHA team is thankful to everybody. Over to you, Dr. Bulbul, and in the meanwhile, people can respond to questions for the ones that have not been responded in the chat. Thank you.
Thank you very much, Somesh, and good afternoon and good evening, friends, distinguished panelists, all the guests who joined for today's webinar, ladies and gentlemen. On behalf of USAID-supported NISHTHA JPIGO program, I welcome you on the occasion of the Global Hand Washing Day and thank the panelists for a very insightful discussion on something which we have known for a long time. Hand washing is not new. As Anuradha said, we have known the advantage of hand washing for a donkey number of years. But when it comes to practice, we are still struggling how to ensure that there's a universal hand washing done all time, every day, every occasion when it is required. I think from the discussion, it is clearly very apparent that we can only achieve this if we work in partnership and a sustained partnership. Unfortunately, many times you start with something, but it goes on for a year and then you say, okay, it will be, now it will be just, it will carry forward. It doesn't happen that way. And as, Richard said, behavior modification, behavior change are most difficult. And to sustain those changes, you have to give the nudges all the time. till it becomes part of the DNA of everyone. So I would really urge that, if we can all put our minds together, I think we can crack this issue of why hand hygiene or simple hand washing is not practiced. And, data has been there. We know it is cost effective, but what we have to do to, I would say, actually come up with innovative solutions, simple solutions, so that everyone, every woman, every child, every, man, everyone is practicing this simple behavior, and we will be able to, of course, save millions of lives. COVID-19 has definitely given an impetus to hand washing. And I think we all know that everybody's been talking about the wearing of masks and keeping distance, and of course hand wash and sanitization. And what I have seen in last 1.5 years, that a lot of places where we never expected anyone to have a hand sanitizer or a place where you could, go and have, you wash your hands, a soap is there. So I think it is possible. What I feel that it is possible, it is doable. I don't think it is just a cost, but it is the attitude that we have to change of everyone who is involved in this simple behavior change. And as Mr. Dilip Kumar said, that you have to, inculcate this habit from the very beginning. It is done with the nursing fraternity, it's done with the medical fraternity, it's done with the lab technicians and other, but over a period of time, we all tend to forget it. So I think the nudges, we'll have to find better way of nudging people to ensure that, you continue with this change. Of course, you have to work on the demand side, you have to work with also market shaping. But, I feel it is doable. And I think COVID has given this opportunity to all come together, work together and find a way out. So thank you very much for everyone for joining in. Look forward to working with everyone. And, it's been a privilege to hear all of you. Thank you very much.
All right. Thank you, everyone. Stay safe. Keep hand washing. Please stay safe and safe.
Thanks so much. Thanks, everybody.
Thank you.
Thank you, everyone. Bye.
Thank you.
Thank you.